Welcome to the Deep Dive. Today we're diving into a really important topic for anyone who loves a dog, canine infectious viral hepatitis. You might hear it called CAV1.
That's right.
We've got some pretty detailed information here, breaking down what this virus is all about. Our goal today is really to pull out the crucial stuff, what it is, why it's a threat, what you might see if, your dog gets sick, and really importantly, how you can protect them.
Absolutely.
Think of this as your quick guide, sort of a shortcut to understanding what you need to know about CAV1.
Okay, so let's jump right in. Canine Infectious Viral Hepatitis, CAV1. It's a virus and it targets dogs, but also other animals in the dog family, the Canidae family.
Right.
Now, it's interesting because serologically, how the body reacts, it's pretty uniform.
Yeah.
But it is antigenically distinct, meaning it's different from another common dog virus, the canine respiratory adenovirus, or CAV2.
Okay. So they're different viruses, even though they sound similar.
Exactly. Different enough that, immunity to one doesn't automatically mean immunity to the other.
Got it. So when this CAV1 virus gets into a dog, where does it, cause the most trouble?
Well, what's really striking is how it doesn't just hit one spot. Its main targets are what we call parenchymal organs. Think major working organs.
Like the liver. I think I saw that mentioned.
Exactly. The liver is a primary target.
Yeah.
But it also goes for the eyes and the endothelium.
Endothelium. That's the...
That's the inner lining of the blood vessels.
Yeah.
And typically a dog gets infected just by, sniffing or licking something contaminated through the nose or nasal exposure.
Okay. And then how does it spread inside the body? What happens next?
So once it's in, it doesn't take long to get into the bloodstream, usually within about 4 to 8 days. That's when we get viremia. The virus is actually circulating in the blood.
And is that when the dog becomes contagious?
Yes, around then they can start shedding the virus in their saliva and their feces. The virus's first stop, sort of its initial attack points, are these specific immune cells in the liver. They're called Kupffer cells, and also that endothelium, the blood vessel lining.
Kupffer cells, like immune cells specifically in the liver.
Precisely. And the virus starts multiplying inside these Kupffer cells. Now, this is where it gets, quite damaging. As it replicates, it injures the main liver cells right next to them, the hepatocytes.
Ouch.
Yeah. And that damage causes a huge release of virus particles back into the bloodstream. So you get this second, much bigger wave of viremia.
Wow, that sounds like a really aggressive cycle. So what's the body's defense? How does it fight back?
Well, the immune system does try to step up. If a dog mounts a good response, produces enough of the right kind of antibodies, these neutralizing antibodies can usually clear the virus from most organs within about, say, 10 to 14 days.
Okay, so there's hope for recovery then.
Definitely. But, and this is a really key point, the virus is sneaky. It can actually hide out in the renal tubules.
In the kidneys.
That's right, tiny structures in the kidneys, and it can keep being shed in the dog's urine for a surprisingly long time. We're talking maybe 6 to 9 months.
6 to 9 months. Wow. That's a long shedding period.
It really is. And it has implications for spreading the virus, obviously.
You mentioned something else, too, about chronic hepatitis. What happens there?
Yes, that's another important outcome. Sometimes a dog's immune response isn't strong enough to completely eliminate the virus. They might have only a partial antibody response.
Okay.
In those cases, the infection can kind of simmer away and turn into chronic hepatitis, so long-term inflammation and damage to the liver. It just doesn't fully resolve.
And that distinctive sign, the hepatitis blue eye, is that related?
That's a fascinating and quite specific complication. It's actually a form of eye injury triggered by the immune system's response to the virus within the eye. It causes inflammation in the front part, anterior uveitis. This inflammation leads to swelling in the cornea, the clear front part of the eye, giving it that characteristic hazy bluish look.
And that can happen even with the vaccine.
Interestingly, yes. It's rare, about 1% of dogs, but it can occur after vaccination with a modified live virus, MLV vaccine, for CAV1. And just like with a natural infection, these dogs can also shed the virus in their urine for that same 6 to 9 month window.
Okay, that's good to know. So let's talk risk factors. Who is most likely to get CAV1?
Well, as we said, dogs and other canids like foxes, wolves, The information suggests there isn't really a specific breed or sex that's more prone to it,
Right.
but age is a big factor. It's most commonly seen in dogs younger than 1 year old.
Puppies, basically.
Young dogs, yeah. And the absolute biggest risk factor, the one that overrides pretty much everything else, is vaccination status. Unvaccinated dogs are just far, far more susceptible.
Okay, so vaccination is key. We'll come back to that. Now, if a dog does get infected, what are the signs? What should an owner be looking out for?
It really depends, Depends on the dog's immune system, how much initial damage the virus does. It's a spectrum.
Right.
At the most severe end, there's something called the paracute form. This is incredibly rapid. You see a high fever, sudden neurological signs. The circulatory system can collapse, vascular collapse, and that dangerous clotting condition, DIC.
DIC, disseminated intravascular coagulation.
Exactly, where blood clots form all over. Tragically, this paracute form can kill a dog within hours.
Oh, wow. That's terrifyingly fast.
Is there a slightly less immediate form?
Yes, the acute form. Still very serious, make no mistake, but it develops a bit more, let's say, gradually over maybe a few days.
Okay, what does that look like?
You'll likely see a fever. They'll probably go off their food. Anorexia, seem really tired, lethargic. Vomiting and diarrhea are common. A vet might feel an enlarged liver, that's hepatomegaly, and the dog might show signs of abdominal pain. Sometimes fluid builds up in the abdomen. And that blood vessel inflammation we talked about, vasculitis, can cause little pinpoint bruises, petechiae, or just general bruising. DIC can happen here too, plus swollen lymph nodes, and occasionally inflammation in the brain. Still sounds incredibly serious. Is there a milder version?
There is what's often called the uncomplicated form. The signs here are more general, things like lethargy, maybe not eating as much, a fever that comes and goes, perhaps swollen tonsils, some vomiting or diarrhea, enlarged lymph nodes again, maybe a slightly enlarged liver, and some belly pain.
Okay.
But what's really interesting here, and sometimes confusing, are those later signs. Remember the blue eye?
Right, the anterior uveitis and corneal edema.
Exactly. That can show up about 4 to 6 days after the initial infection in maybe 20% of dogs, so about 1 in 5.
And does that clear up?
Usually, yes. It typically resolves within about 3 weeks. But sometimes it can progress and cause more serious eye issues like glaucoma or ulcers on the cornea. And here's the key thing. Sometimes that blue eye is the only sign you would notice. The dog might have had a really mild, otherwise unnoticed infection, and then boom, the eye changes.
So the blue eye could be the only clue they even had CAV1. Okay, so if a vet suspects CAV1, given these varying signs, what else do they need to consider? What are the differential diagnoses?
Good question. Yeah, ruling things out is crucial, especially in very young pups. Canine herpes virus is a big one to differentiate.
Right.
Then you've got other things that cause liver problems, other infectious causes. Leptospirosis, which is a bacterial infection, a condition called granulomatous hepatitis, or even liver damage from toxins.
Makes sense.
And because CAV1, especially the acute form, can look like other really severe systemic diseases, vets will also think about things like parvovirus and canine distemper.
Okay, a lot to rule out. What tests help the vet figure it out?
Blood tests are usually the first step. A complete blood count, the CBC, that can show some typical changes. Early on, you might see low white blood cells, leukopenia.
Okay.
Then, as the body fights back, that often flips to high white blood cells leukocytosis with specific types of reactive cells, sometimes even immature red blood cells showing up.
And what about blood chemistry? Looking at organ function.
Yes, that's vital. Liver enzymes are usually high initially, but hopefully they start coming down within about 2 weeks if the dog is recovering. Really low blood sugar, or low albumin, which is a key protein, can indicate severe liver failure, that vasculitis, and maybe toxins from bacteria in the blood. You might also see low sodium and potassium, often from the vomiting and diarrhea, and if the dog survives the first few days, bilirubin might go up, leading to jaundice, that yellowish tinge.
What about checking the urine, a urinalysis?
Also very useful. Finding protein in the urine can point to kidney damage, specifically the filtering units. Seeing things called granular casts suggests damage to the kidney tubules themselves, and bilirubin in the urine, that goes along with the jaundice.
Are there tests that can specifically detect the CAV1 virus itself or the response to it?
Yes. Coagulation tests checking blood clotting times are important because of the risk of DIC. They reflect how badly the liver is affected too.
Okay.
You can test the blood for antibodies against CAV1, but they're a catch.
The vaccine.
Exactly. A recent vaccination will also cause antibodies to show up, so you have to interpret that result carefully, considering the dog's vaccine history.
Right.
It's also possible, though sometimes difficult, to actually isolate the virus itself, grow it in a lab from samples from the eye, kidney, tonsils, or urine. It's harder to get it from organs like the liver after the first week or so.
And imaging, like X-rays or ultrasound, can they help?
They can add pieces to the puzzle. Abdominal X-rays might show if the liver is enlarged or maybe normal sized. But if there's a lot of fluid in the abdomen, the picture can be quite hazy, hard to see detail.
Sure.
Ultrasound is often more revealing. It might show the enlarged liver, maybe changes in its texture. It might look patchy or darker, and it's good at detecting that abdominal fluid or effusion.
And for a really definitive diagnosis, is there a gold standard?
Well, a liver biopsy can be very helpful. Looking at the tissue under a microscope, pathologists can sometimes see characteristic changes inside the liver cells caused by the virus, these intranuclear inclusions. Combine that with viral culture attempts or comparing antibody levels in blood taken early in the illness and then again a few weeks later. That's called acute and convalescent serology. Those can really help nail the diagnosis.
Okay, so let's say a dog is diagnosed with CAV1. It sounds like they need intensive care. What does treatment involve?
Absolutely. This usually means hospitalization. Aggressive supportive care is the mainstay. 5E fluids are critical, using balanced electrolyte solutions to combat dehydration. Vets need to be a bit cautious with fluids containing lactate if the liver failure is really bad. And because those blood vessels can be leaky from the vasculitis, they have to monitor fluid therapy really carefully to avoid overloading the system.
Right, don't want to make things worse.
Exactly. Supplementing electrolytes like potassium is often needed because low levels can actually worsen the neurological signs if the liver isn't working properly, what we call hepatic encephalopathy, or HE.
Okay.
And preventing low blood sugar, neuroglycopenia, is vital too. So dextrose, which is a type of sugar, might be added to the IV fluids.
You mentioned clotting problems and leaky vessels. What about blood products?
Yes, blood component therapy is often necessary if there's significant bleeding or clotting issues. Using actual blood products like plasma or whole blood is generally better than synthetic colloids for keeping blood pressure up in these cases, because the synthetic stuff tends to leak out of those damaged vessels too quickly.
I see.
For dogs showing clear signs of DIC, treatment might involve fresh plasma or fresh whole blood, and sometimes low doses of an anticoagulant like low molecular weight heparin.
What about feeding them if they're vomiting or feeling awful?
Nutrition is really important for recovery. If the dog can tolerate it, small, frequent meals are ideal. The focus is on getting enough calories and the right nutrients. Protein needs careful management. You only restrict it if there are definite signs of that hepatic encephalopathy, the neurological issues.
And that they just won't eat?
Then we might need to consider feeding them intravenously, either partially or totally. That's parenteral nutrition.
Okay. Are there specific medications used to target the virus or manage symptoms?
There's no specific antiviral drug that cures CAV1, unfortunately, so treatment focuses on managing the consequences. Prophylactic antibiotics are common.
Why antibiotics if it's a virus?
Good question. It's because the gut barrier can become leaky, allowing bacteria to get into the bloodstream. So the antibiotics help prevent secondary bacterial infections or septicemia, things like carcillin, metronidazole, maybe fluoroquinolones.
Got it. What else?
Antiemetics are crucial to control the vomiting drugs like metoclopramide, ondansetron, or meropitant. Gastroprotectants like famotidine or sucralfate help protect the stomach lining. If hepatic encephalopathy develops, there are specific treatments for that, managing the neurological signs. And then there are drugs aimed at supporting the liver itself.
Like what?
Ursodeoxycholic acid can help with bile flow and has some liver protective effects, especially useful if it becomes chronic hepatitis. And antioxidants are often recommended, things like vitamin E, intravenous N-acetylcysteine initially, followed by oral same S-adenosine.
Right, supporting liver function.
Exactly. And one more crucial point on meds days, vets have to be really careful with dosages. Liver injury, protein loss, the dog's age, all these things affect how drugs are processed, so doses often need adjusting.
Makes sense. So we've covered how serious it is, how it's treated.
Yeah.
But let's circle back to prevention. You said vaccination is key.
Absolutely. Prevention is by far the best approach. And the good news is we have a very effective vaccine. It's a modified live virus, or MLV, vaccine.
So how does the schedule usually work?
The standard protocol is to start puppies at around 6 to 8 weeks old. Then they get boosters every 3 to 4 weeks until they reach about 16 weeks of age.
Okay, a series of shots.
Right. Then typically another booster is given a year later, around the 1-year mark. And after that, well, the immunity from this vaccine is generally considered very strong and long-lasting. Subsequent boosters might not even be necessary for CAV1 specifically, although dogs will still need boosters for other diseases, of course.
That's really good to hear. A highly effective vaccine. But even with treatment and potential recovery, what are the lingering risks? What complications can occur down the line?
Yeah, unfortunately, even with intensive care, some dogs can develop serious complications. We've touched on some. That sudden, overwhelming liver failure, fulminant hepatic failure, the hepatic encephalopathy, septicemia, that bacterial blood infection. Acute kidney failure is possible too. DIC, the clotting disorder. Eye problems like glaucoma. And as we mentioned, the risk of developing chronic hepatitis.
So the prognosis, the outlook, really depends on the form of the disease.
Exactly. Those peracute cases, the outlook is very poor, often fatal very quickly. The acute cases, it's variable. It can range from guarded, meaning uncertain, to potentially good with aggressive treatment.
And the chronic aspect.
Dogs that don't mount a strong initial antibody response are the ones most at risk for developing that chronic hepatitis later. But dogs that do have a good immune response might recover pretty quickly, maybe within 5 to 7 days.
But is recovery always complete?
That's the sobering part. Even dogs that appear to make a full recovery might still be susceptible to developing chronic liver or kidney disease later in life, potentially as a long-term consequence of the damage caused by the virus.
Okay, so let's wrap this up. To summarize, canine infectious viral hepatitis, CAV1, it's clearly a serious threat, particularly for young, unvaccinated dogs.
Definitely.
It hits multiple systems, primarily the liver, eyes, and blood vessels, leading to a really wide range of signs, from almost unnoticeable to, well, rapidly fatal. Treatment is intensive supportive care, and diagnosis involves ruling out other conditions and using a combination of tests. But the absolute key takeaway seems to be prevention through vaccination.
Without a doubt, vaccination is incredibly effective.
And it's important for owners to know that even after recovery, there could be these potential long-term echoes like chronic liver or kidney issues.
Precisely. And that leads to a final thought, really. When you consider that potential for chronic disease developing years later, even after a dog seems fully recovered from something like CSU1, it makes you wonder, doesn't it? What are the less obvious, maybe lifelong health implications of these kinds of significant viral infections early in a dog's life? You know, what further questions does this raise for you about how viruses might persist, maybe subtly, or how they trigger these longer-term chronic conditions we see later on? Something to think about.